So guys, I will be sharing my experience I had after circumcising my baby here in Canada. As you all know, I recently gave birth to a baby boy and I have two sons. I gave birth to one in Nigeria, while the second one here in Canada. So if today is your first time of coming to my video, I'm not simply act for some people, because some people don't do it, why some in their culture. For instance, where I'm coming from is in our culture and is also in my belief to do that. After delivering my baby, I asked, okay, how am I going to run about it, because I've not given birth here in Canada before. This is my first time. So the nurses were like, okay, I have to meet my family doctor, that my family doctor will have to be the one to perform that. So I'm reaching my family doctor after 1 week postpartum. The family doctor said that he does not have the license to do it, that he don't do it, but he will give us the link to people that perform that procedure here in. So he gave us the link. We have to book for the appointment. So after booking for the appointment, before your appointment is granted, you have to make payment of 510 Canadian dollars. So we did that. So after that, they have to give us instruction on what to bring or what to do before the appointment. So we asked that we should get a pain relief for my baby boy, that give 30 minutes before the procedure. So I gave the pain relief. And at the end of the day, when we came to the clinic for the procedure, the procedure was done in less than total of 15 minutes, because when the doctor came and examined him, everything was done. They have to give him anesthesia to be less painful and discomforting when they are doing the procedure. So after that, they packed the area with Vaseline gauze and also a bandage too. So they also gave me instruction that I have to ensure that the baby is not bleeding. If the baby is bleeding, if the baby is cannot urinate, if the baby cannot if he's having unexplainable fever, I have to make sure to bring him, or I have to bring him to the clinic. Okay, if that's in continuous, or if I see I or if such thing happens, I have to bring him back to the clinic. So after the doctor has done that, he has packed the also come back to check if the baby is bleeding, if the baby is having hemorrhage or bleeding, before we are allowed to leave. So after 10 minutes, the doctor came back, the baby was fine. So we're asked to leave. And also they also gave us home care instructions that I have to do. So after 24 hours, I have to come back to the clinic to see the doctor. So that is it. So home care now. So after 24 hours, I have to remove the bandage that the doctor have to place there, change the Vaseline gauze and all, and making sure that the water does not touch the area, and the baby should avoid bathing for 1 week. Okay. So if there's any contamination, maybe like poop or something that is around that particular place they did the procedure, you have to use a drop of water to remove that, so that it will not cause discomfort by using, maybe when you want to use wipes, so that it does not cause discomfort for the baby. So you have to make sure that the baby is in good condition, make sure that the place is very clean. Before then, I was the hospital gave me the Vaseline cream, they gave me the gauze that I have to use for the parking of that particular place. So my baby was fine. And normally you have to do this thing when the baby is still small, very small. Okay. And the average ages are 0 to 4 months. In my place, I think we usually do around 7 to 8 days when the baby is still is very small, so that he doesn't remember all this pain and all of that. So that is it. So for some people, they don't do it. Why some they do? That's why it's not covered by the government in Canada here. So different provinces have the way they do their things, have the different amounts for it. You know how they run. I know you've learned one or two things from, so you have to make sure that the baby is in a comfortable position. Make sure that you're always checking the baby and all of that. So that is it for now. Thank you.